Members, good morning. It's the appointed time and we have a quorum. I call to order the meeting of the panel on health services. Agenda item 1, information papers issued since the last meeting. After the last meeting, the Secretariat has not issued any information papers. Agenda item 2, items for discussion at the next meeting. The panel will, at 10:45 a.m. on the 8th of April, hold the next regular meeting. The administration proposes discussing the following items. 1. Implementation of the Advanced Decision on Life-Sustaining Treatment Ordinance. 2. Update on the operation of CUHK Medical Center. 3. Implementation and effectiveness of the public health care fees and charges reform, including the arrangements for drug subsidies. Do members agree? Yes. Is it that we are going to discuss all these items in one panel meeting? We all have our concerns about the public health care fees and charges reform. And also, members are very concerned about the loan situation of the CUHK Medical Center. So should we urgently discuss all these 3 items in one meeting? I think we should think about this. Yes, Ms. Rebecca Chen. Oftentimes, when we have 3 discussion items scheduled, we do not have enough time to finish the discussion. I'd like to suggest one more item, actually, but not at the same meeting. I think there's a rather urgent item that we need to discuss, and we need the explanation from the administration, that is, how the hospital authority deals with privacy issues concerning their patients. This is because of the incident that happened recently. The administration hasn't explained in detail at the LegCo. I think the administration should explain to members about their cybersecurity network as well as how they deal with privacy concerns of their patients. Yes, Mr. Peter Xu. I share the same views with the 2 members. In this new term of LegCo, members work very hard on expressing their views. There are 20 members at this panel, and if they all speak, well, for example, at the FAP meeting, there are 3 discussion items scheduled as well. I just came here 2 to 3 minutes ago, and they were still on the first discussion item. They haven't even touched on the 3rd discussion item. Members would like to pose lots of questions at the panel meeting, so you either have a longer meeting or you shorten the discussion items. Understood. The item in relation to the implementation of the Advanced Decision on Life-Sustaining Treatment Ordinance, I believe we can't move this item because it's about the implementation of a new policy. As for the update on the operation of CUHK Medical Center, again, I don't think we can move this item. And as for the public healthcare fees and charges reform, it will be implemented next month. So I will discuss with the administration to see what we can do. Yes, Mr. Kingsley Wong. Chairman, I think this is quite important. I think we either make the meeting longer or we shorten the discussion item list. Perhaps we'll have a longer meeting. Thank you. In relation to the discussion item about the CUHK Medical Center on the 21st of April from 9 to 11:30 a.m., members of this panel will visit the CUHK Medical Center. The Secretariat has issued a circular inviting members to join the visit, so please sign up by 5 p.m. today. The Secretariat will let members know about the arrangement of the visit later. Now we proceed to discussion item 3 of today's meeting, progress of reform of drugs and medical devices evaluation and approval mechanism and legislative proposal for the establishment of the Hong Kong Center for Medical Products Regulation. I'll invite the government officials to join us. This is a legislative proposal, so all members of LegCo are invited to join the discussion of this item. From the administration, we have Secretary for Health, Professor Lo Chung Mau, Deputy Secretary for Health, Mr. Raymond Wu, Principal Assistant Secretary for Health, Ms. Trinky Chen, Director of Health, Mr. Ronald Lam, Assistant Director of Health, Preparatory Office for Center for Medical Products Regulation, Mr. Lot Chen Sito.
早晨，局長。
Good morning, Secretary. Welcome, Secretary and your team.
咁請有意係發言嘅。
Members who would like to speak, please press the Request to Speak button at your seat. I'll invite the administration to walk us through the paper. Secretary, please. Chairman, today, I, together with my colleagues, are here at the panel meeting to report to members about the progress of the reform of drugs and medical devices evaluation and approval mechanism. We'll also brief members on the legislative proposal for the establishment of the Center for Medical Products Regulation. Medical products have to do with people's lives and health, and it also has to do with the development of new productive forces, and so this has to do with the strategy of our country. Our country is developing rapidly in this regard. In the 14th and 15th National 5-Year Plans, it is repeatedly stated that we have to accelerate the evaluation and approval mechanism of drugs and medical devices. In the 2023 policy address, the CE said we have to reform the approval and registration mechanism for medical products and push for the transformation of R&D outcomes so that we can dovetail with the national plan. We're currently working to take forward the primary evaluation mechanism, and we are working to establish the Center for Medical Products Regulation. We are on all fronts working to promote this. For example, in October 2023, with the support of the National Medical Products Administration, we became the ICH observer. We help to promote the drug regulatory mechanism in Hong Kong. Our goal is to become a member of the ICH. We believe that with the establishment of the new center, we'll be able to apply for accession to ICH in 2027. Also, in June 2024, we set up the preparatory office of the new center. Our goal is that within this year, we'll be able to, under the Department of Health, set up a new regulatory center. And in the long run, we want to be a renowned international regulatory center. Since 2023, we've already established the 1+ mechanism. So far, we have 19 new drugs approved under this mechanism. For example, there are 7 new drugs that are approved to be included in the HA formulary. We have sped up the introduction of new drugs, and this helps bring new hope to our patients, and this also paved way for the establishment of the primary evaluation mechanism. Also, this March, we already rolled out the first phase of the primary evaluation mechanism, and it covers registration of drug products containing chemical entities with extended applications, such as new indications, new strengths, new posology, and new dosage forms. Subsequently, we will, in accordance with our roadmap and timetable, extend this scheme. Our target is that we will launch the full implementation of the primary evaluation scheme by 2030. Drugs developed by leaps and bounds, the SAR government is trying to seize the opportunity to develop ourselves into an innovative health hub. By establishing primary evaluation, we'll be able to leverage our unique advantages under one country, two systems, and this can help our innovative medical technologies go global. The SAR government strives to establish a complete regulatory system to dovetail with the development of our country so that innovative health technologies can be spread to the world and that we can have a say in the international arena. By the second half of this year, we will table a bill to empower the Director of Health, and will also give statutory functions to the new center and give a new positioning to the new center. Now, I will invite Assistant Director of Health to brief members on the legislative proposal. Yes, Mr. Chen. Thank you, Secretary. Thank you, Chairman. I will now brief members on the progress of the reform of the evaluation and approval mechanism, as well as the legislative proposal. To dovetail with the national 14th and 15th five-year plans, we hope to improve the evaluation and approval mechanism of drugs and medical devices. We also would like to reform the mechanism so that we can transform the R&D outcomes so as to develop Hong Kong into an international medical innovation hub. In 2023, 24, and 25, the CE mentioned in the policy addresses the relevant work. In 2023, the CE proposed the setting up of the Center for Medical Products Regulation. In 2024, he said there will be a roadmap and timetable for the primary evaluation mechanism. In the latest policy address, the CE also said, within this year, we will officially establish the Center for Medical Products Regulation. So there are various aspects to our work. We will establish the new center to improve the evaluation and approval mechanism. The most important thing is to implement the primary evaluation system. In June 2024, the Department of Health already established the preparatory office to monitor the establishment of the new center. Second, we want to roll out the 1+ mechanism. At the end of 2023, we already launched the new mechanism. For example, in the past, new drugs can only be registered in Hong Kong with the approval from 2 or more jurisdictions. Now, with local data, pharmaceutical companies can register in Hong Kong any new drugs. This helps speed things up. On the 31st of March this year, we announced that we have already launched the first phase of the primary evaluation mechanism. We hope to see full implementation by 2030. Thirdly, we hope to join the ICH so that we can align with international standards. Towards the end of 2023, we became an observer of the ICH. We hope that we can officially become a regulatory member of the ICH soon. In relation to the latest progress, as mentioned, we have already announced the implementation of the first phase of the primary evaluation, and that covers drugs with chemical entities. In relation to the first phase, after completing the first phase, we will take forward the second and third phases, and that covers advanced therapy products as well as drug products with biological entities. By 2030, we will see full implementation of the primary evaluation mechanism. On the other hand, we hope to enhance our monitoring capabilities through various means. We train up our own professionals, and also we recruit experts from overseas with experience so as to allow us to align with international standards. Thirdly, we want to align with international regulatory organizations. We have been deepening collaboration with the GBA as well as the national organizations. We also have been working with international regulatory organizations. We also strive to become a regulatory member of the ICH. To become a member of the ICH, we have to achieve the following. We have more or less achieved the requirements. So we hope that we can, after the establishment of the center, for medical products regulation will be able to submit the application to become an official member of the ICH. We will also amend relevant legislations. There is a legislative proposal from us to establish the new Center for Medical Products Regulation. We will amend existing legislations that have to do with Chinese medicine as well as Western medicine so that we can better promote drug regulatory work.
With regard to legislative amendments, we will be looking at the existing pieces of legislation. We have Chinese medicine and Western medicine. We have two separate pieces of legislation to regulate these. And there are also different regulatory authorities and also a legal enforcement agent which is responsible for regulating these. And for medical devices, we do not have a dedicated piece of legislation for that, but then we have already got this administrative management system to regulate the use of medical devices in Hong Kong, in particular high-risk medical devices that are used in Hong Kong. So on regular basis, we would be reviewing that, and we are also going to introduce a new piece of legislation to regulate medical devices, and we'll be tabling that bill shortly before this council. So what happens next is that we will be legislating to establish formally the CMPR in order to align with the international best practices and to enable the center to have the legal basis. And we will also be clarifying that the CMPR as the medical regulatory authority, so it will be given legal status for that, and also the Director of Health. And also the CMPR will also be responsible for regulating Chinese medicine and Western medicine. So we'll be amending the existing legislation in order to implement those initiatives, and the regulatory authorities would also be transferred to the DFH as well as the CMPR to regulate both Chinese and Western medicine, and also to enhance the administrative effectiveness or efficiency. And we will also be stating that there are three main objectives under this. First, the center will be responsible for executing functions relating to medical devices, and it would also be responsible for making recommendation and giving advice to the Bureau on related issues, and also policies and initiatives will also be proposed by them. And on behalf of the HKSAR, it would also be participating in international collaboration in respect of matters relating to medical products regulation. When it comes to regulating both Chinese and Western medicines, we have already got existing legislation for those purposes, and therefore we propose to amend the existing legislation. Well, for the PPO, the Pharmacy and Poisons Ordinance, which is responsible for regulating Western medicine, we have got this board who is responsible for regulating pharmacists and also the ASPs, the authorized sellers of poisons. And then under the board, we have also got executive arms for enforcement purposes. For example, the licensing of the ASPs and so on. We have got 5 committees responsible for that. Two other committees, which is called which are the Pharmacies and Poisons Board, which are responsible for the categorization of poisons and so on. And through that committee, it would be giving advice to the Pharmacies and Poisons Board, so that it would also be regulating the sale of such products. And then there is also this authority which is responsible for regulating the licensed or registered persons, including pharmacists and so on. And there is also an appeal mechanism under the relevant legislation. What we are proposing now is that we are going to amend the PPO so that the PPB, which is responsible for regulating medical products and so on, that will be transferred to the DFH. And then for the regulation of pharmacists, that will be kept under the PPB. And therefore on this, we are going to propose amendments to the name of the PPB. And for the time being, we just call that the council, and then they'll be responsible for the regulation of pharmacies. And then the previous board and its various committees under the PPO will continue to provide professional support and advice to support the DFH and also the CMPB, which will be responsible for approval of drugs and also licensing of the ASPs and the disciplinary matters and so on. If there is any appeal with regard to the approval of drugs and otherwise, so under the existing mechanism, they can still lodge appeals with the existing board. So those are the proposals that we are proposing. And then for Western medicine, for Chinese medicine, well, at present we have the CMCHK. We call that the council, which is responsible for regulation of Chinese medicine and also Chinese medical practitioners. And they have the CMB, which is responsible for the registration of Chinese medical practitioners. And also we have the Chinese medicine board, which is responsible for the registration of PCMs and also the licensing of Chinese medicines, traders, and so on. And under the CMB, we have also got 3 subgroups responsible for the registration of PCMs, the licensing of Chinese medicine traders, and also the regulation of the Chinese medicine traders. And the appeal mechanism is not as stringent as that for PPB or Western medicine, and therefore for the CMB and the Chinese medicine products board, if they have any grievances, they will have to appeal to the board, and if there is further grievance, then they will have to appeal to the court. But then there are also similarities. The Chinese medicine board under the CMC, in terms of the regulation of Chinese medical practitioners, there will be no change. But then for the Chinese medicine products board, the power will be transferred to the Director of Health, while it will continue to provide professional support and advice to the Director on relevant regulatory matters with a view to reducing structural overlap. And if there is any grievance against the decision taken, then we will set up a new panel to handle such appeals. And if so, that would be the Chinese Medicines Appeal Tribunal. And if they have further grievances, then they can, of course, appeal to the Court of First Instance. So the bill will be submitted shortly, and after the setting up of the CMPR, we will further review the relevant legislation, including the CMO and also the PPO, because those 2 pieces of legislation have been in place for a long while, and it's time for us to conduct a review, and we will also be consulting the stakeholders. And then after we have completed the review, we will also ensure that the CMPR will be made a statutory independent body, and we will be further proposing legislation on that. Okay, the floor is now open. We have 12 members who have indicated that they'd like to speak, including Chen Hock-Fong, Hong Kam Yin, Chen Pui Leung, Yong Wing Kit, Joey Chen, Chu Lep Wai, Chen Hoi Yen, Grace Chen, Xiu Ka Fai, Chen Wing Kwong, and Christine Fong, and myself. So 4 minutes each, including both questions and answers. First, Mr. Chen Hock-Fong. Thank you, Chairman. Well, I support the setting up of the CMPR because this is an important step forward in terms of regulation of such devices, because we do need to take the first step before we can improve our medical products, and that's also for the benefit of the community, and therefore I fully support it. But I hope that the administration can clarify several points. After we have done the primary approval, what about next? Have we done any estimates as to how many medical products will come will be registered under that system. So we have the 1+, and we have 19 such categories. And after we have completed the primary evaluation and approval, so have you conducted any assessments as to in the next 5 years how many medical products will come up for such evaluation and approval, so that we can have an expectation as to what is going to happen? That's the first thing. Second, about talent nurturing, because you have an independent regulatory authority which will be set up under the Department of Health, and they will be made separate and independent shortly afterwards. So that would also benefit the nurturing of talents. But then what about the future independent body and also the evaluation body? So have you looked into the possibility of integrating that with our university programs? Can they offer special programs so that our graduates can directly enter the system? That's the second point. And thirdly, with regard to clinical data, so we're working with the GPA, and I understand that a central or an integrated database has been set up. But what about the establishment of this mechanism? Because we need a lot of data. So have you considered extending it to the entire country so that the data from the entire country can be integrated into the system? That would also expedite the process. So have you considered that? Thank you. With regard to primary evaluation and approval, well, for innovative medical products, the development is very rapid, and therefore sometimes it's hard to make an accurate estimate, because it's hard to imagine. For example, 5-10 years ago, it would be hard for us to imagine that in 5 or 10 years there would be innovative medical devices. For example, in the past there might have been conditions which could not be treated. For example, target treatment, and also biochemical treatment, biological or genetic treatment, and so on. But in the past, well, it would have been unimaginable. But now we are able to carry out comprehensive evaluation, and there are also first-of-a-kind medical devices and drugs that might come up for approval. So that depends on the developments. But then one thing is very important, that is, in establishing such a mechanism, the old mechanism is still in place. That is, the secondary evaluation approach will still be there. And therefore, with one additional tier of approval, then we'll be able to have one more chance to approve them. And also, in terms of medical devices, quality and if efficacy would be very important. Our purpose is not to go for a large number of new drugs to be introduced into Hong Kong. The most important thing is to ensure that they are both effective and safe. And then on the second point about talent nurturing, well, some universities have already started some new programs on the scrutiny or approval of medical products and so on. And on clinical trials, there are also research personnel doing that. Well, at the GPA Clinical Trial Institute, they are also going to set up a center that is for the purpose of clinical trials. That would be helpful. We would also be considering recruiting talents from all over the world for those purposes. What about data? Well, on Data Connect, well, for every single drug, depending on the how it's to be administered and what it should be used for, and therefore we are not going to try and get data from the entire country for us. But then if a particular drug has already been approved in the GPA system, then we would consider doing that on a case-by-case basis. Next, Mr. Hong Kam Yin. Thank you, Chairman. I support the proposed reforms to the drug and medical devices evaluation and approval mechanism, and I also support the setting up of the Center for Medical Products Regulation. With regard to the efforts made by the administration in this regard, we fully recognize that, because that would also be helpful to promoting the development of our country. I'd like to ask a couple of questions. First, with regard to the setting up of the CMPR, I understand that there are new functions, for example, integrating the regulation of Chinese and Western medicines, and it would also be doing primary evaluation, and they would also be responsible for approving medical products and devices and so on. What about the cost to be incurred? Can you disclose that to us? And also for the manpower establishment and also the support staff, can you tell us exactly what kind of resources you will need? And also the future legislation, will you introduce or will you launch any public consultation? Because some stakeholders might be concerned, for example, the beauty sector might be concerned, and therefore, can you consult them as well so that they can also voice their comments?
Secretary, in relation to the questions about manpower as well as establishment, I will ask the Deputy Secretary to reply. Yes, Mr. Wu. In relation to the establishment of the CMPR, we will first consolidate manpower that works on Chinese medicine as well as Western medicine so as to enhance their regulatory capabilities. Second, thanks to LegCo, there will be 4 new directorate officers. We have created 4 new posts, and these post holders will oversee the daily operation of the new center. Also, we will deploy manpower that include 7 directorate officers to work on the regulation of Chinese and Western medicine. As for non-directorate officers, there will be 420 of them who will form the basis of the new center. As we take forward the primary evaluation mechanism, there will also be overseas recruitment exercises. As mentioned, we will recruit 4 people to fill the controller post. We'll also look at the demand as we recruit talent. As we prepare to roll out the second phase, we have to look at whether we have clinical data and what kind of expertise we need to help evaluate and approve new drugs. We have to see what kind of shortcomings we face. So we will put in resources to recruit new talent. Of course, we will allocate new resources for training as well. As our team becomes mature, we will extend the new phase to all innovative drugs and medical products. As for the second part of the questions, medical products have to do with the lives as well as health of the public. We always stress that we have to ensure the safety and efficacy of our medical products. Around the world, there is regulation over medical products and devices. Therefore, in Hong Kong, we have to speed things up in this regard. Therefore, we will submit legislative proposals within this year to address our shortcomings. The goal of the legislative proposal is to regulate medical products. Any medical devices used by other relevant industries that might pose risks to people's health, I believe there will be a discussion on that. As for consultation, there will be full consultation. Next, Mr. Chen Pui-leung. Thank you, Chairman. In terms of clinical data in Hong Kong, we have our own advantages and resources. The administration will establish the One Institute, One Center model, and there will be resources and services shared by the GBA, and this will attract international pharmaceutical companies as well as those in the medical device sector to make use of clinical data in Hong Kong to develop their businesses and services. I want to ask the administration that under the One Institute, One Center model, apart from providing clinical data to international pharmaceutical companies and those in the biomedical industry, will you work with other governments to see how we can attract international biomedicine companies to establish presence in Hong Kong so as to drive the development of the healthcare sector in Hong Kong? Second, Mr. Chang Hock Fung just now asked how many drugs will be approved under the new mechanism. I also want to learn from the first and to the second phase and to the full implementation by 2030. How much faster will the approval process be under the primary evaluation mechanism? Lastly, in terms of regulation, the CMPR strives to become an internationally recognized regulatory body. Is it that after Hong Kong becomes an official member of the ICH in 2027, Hong Kong will meet the international standards in terms of its approval and regulation? If not, how can we meet the international standards? Secretary, regarding clinical data and our attractiveness, our appeal lies in that international companies can obtain a lot of clinical data to speed up the approval and evaluation process. These are real-world data, and they can complement clinical data. Clinical data themselves are rather expensive, so for pharmaceutical companies, this is a great incentive for them to register their drugs under this mechanism in Hong Kong. And thanks to the national policy, drugs registered in Hong Kong can, through our measure, be used in the 71 designated medical institutions in the GBA. And in the process, we get real-world data, and the data can be used to speed up the approval and evaluation process for drugs that are not yet registered in the mainland. As for how we can attract international companies, as mentioned under the One Institute, One Center model, there will be experiments carried out in the GBA Clinical Trial Institute, and there will be lots of patient cases that companies can make use of. Now I'll ask the director to supplement. Director, as for how much time we are saving, we keep seeing improvement. We have been in communication with international regulatory bodies as well as the relevant industry. To report to members, we have been able to meet our targets all along. For drugs that are approved under the secondary approach, our target is to finish approval within 5 months' time, and we have been able to meet our targets. We have launched the primary evaluation mechanism for about 2 years. Through professional training and upgrading, we've been able to make improvements. Under the 1+ mechanism, within 150 days, we'll be able to complete the process. So we're able to meet our targets. And as for the 19 new drugs approved under the 1+ mechanism, they were all approved within 150 days. The biggest challenge we are going to face is how we can take forward the primary evaluation mechanism. We have talked to the relevant industries, and we have drawn reference from internationally recognized bodies. We understand that the complexity of the 1+ mechanism is less than that of the primary evaluation mechanism. For primary evaluation mechanism, we have to look at animal testing data as well as clinical data. This has to do with innovative drugs that have not been used in other places. So apart from experts in toxicology as well as experts in advanced therapy products. We need these experts and we need more time to ensure our competitiveness, as well as for practical reasons. We cannot work too slowly compared to our competitors, so we are now looking at how much time we need. Secretary, as for the accession to the ICH, if we become a member of the ICH, we will get the recognition from around the world. So if we become a member of the ICH, we will be able to establish mutual recognition with other international approval bodies, and this is also one of the conditions for us to become a member of the ICH. Next, Mr. Kitson Yang. The measure that allows us, Hong Kong registered drugs to be used in the mainland is a very good policy. We have to make use of the advantages under this policy. And in order to do so, we have to take forward primary evaluation as well as establish the CMPR. We also need to become a member of the ICH. According to the paper, by 2030, there will be full implementation of primary evaluation. Currently, we're sticking to the 1+ mechanism. In future, with primary evaluation, will that replace the 1+ mechanism? It is only by fully implementing primary evaluation that we will see advantages and that will be able to attract more pharmaceutical companies to come to Hong Kong. Now we're talking about full implementation by 2030. And currently the administration is taking forward the scheme in phases. We don't want to wait until 2030, however. We want to see full implementation, especially in the Hetao area. If that's the case, with the development of the Northern Metropolis, will things be expedited? Also, there will be the Northern Metropolis University Town. It has to do with our R&D capabilities, with more and more R&D institutes coming to Hong Kong. Will there be collaborations among labs as well as institutes? Secretary. As mentioned, we have rolled out primary evaluation, and that is not to replace the 1+ mechanism or even secondary evaluation. It is up to the pharmaceutical companies to decide whether the medical products should be rolled out in the market of Hong Kong. What we do is to provide facilitation to them and to attract them to have their drugs registered in Hong Kong. Pharmaceutical companies can opt to have their medical products registered in other places first. After the rollout of the primary evaluation mechanism, companies can still make use of the secondary evaluation approach or the 1+ mechanism approach. So the primary evaluation mechanism will not replace the 1+ mechanism. Our ultimate target is to see full implementation by 2030 for primary evaluation. This is because it involves first-of-a-kind drugs and medical products. It is not about changing the dosage or the indications. And it is not about changing the chemical entities of these drugs. We're talking about completely innovative drugs or novel drugs. In the past, no one thought that T cell could be transformed into CAR T cell treatment. And in order to approve this kind of treatment, we need high-level expertise. So to keep in mind safety and efficacy, we have to take this into consideration. So 2030 is already a very aggressive target. In other places or countries, it took them 10 years to completely launch the primary evaluation mechanism. Also, we do not have to rely on the He-Tao area to roll out the primary evaluation mechanism. It is just that He-Tao can provide us with clinical experiments as well as data, and this can be a reference for pharmaceutical companies. Our center is not going to be set up in He-Tao. Also, there will be R&D capability boost with the Northern Metropolis, but again, they're not directly linked to our labs. It's just that as we approve and evaluate drugs, we need experts from universities. We need pharmacologists as well as medical experts for our evaluation and approval process. Even with our existing registration mechanism, we have to rely on experts. So we don't have to wait until the development of the university town to launch primary evaluation. When we see the third medical school established, we will make good use of the experts available. Thank you.
Next, Joey Chen. Thank you, Chairman. First of all, I'd like to thank the government for the proposed reforms, because the FTU has been asking for the good drug Hong Kong use for many years. Initially, we did not include mainland China, but now they can also be registered under the 1+ mechanism. So we can see that there have been gradual improvements. We have been liaising closely with patients groups. We understand that since 2023, we introduced the 1+ mechanism. Some 2-digit number of drugs have been registered under that mechanism. Still, there is room for improvement, and we have also got new drugs that can treat different diseases and so on. And in para 14, we have also seen that you have accepted our proposal. But then, other than introduction of new drugs, we would also need to make sure that they are affordable. So can we have a registration linked system so that so long as new drugs are registered and if they can be used for treating some existing diseases, then they can also be included in the drug formulary of the HA so that they can become affordable to patients. And just yesterday, we also visited the Loop area in the Northern Metropolis with the Innovation Bureau, and I've also made some referrals in order to recruit or invite some merchandisers to come to Hong Kong. But then there are some who are concerned that when it comes to registration of drugs in Hong Kong, if they are innovative drugs, can we expedite the process to enable them to get registered sooner? Because if we have greater autonomy and negotiation power, then we would be able to move forward to primary evaluation. So that's the first thing that we need to do. So I'd like to listen to the views of the Bureau. Yes, Secretary. Chairman, over the past few years, we have already expedited the approval mechanism for medical for new drugs in the past. The NMPA mechanism was not even included in our mechanism of recognized drug authorities. And as you can see now, it's not just that NMPA approved drugs would not just be accepted. In fact, it will be given priority when it comes to registration of those drugs in Hong Kong. And therefore, you can see the change. And therefore, innovative drugs and devices that have been approved elsewhere can also be given priority to be registered in Hong Kong. With regard to introduction of drugs and also their affordability, it's not just about the approval mechanism. And of course, if we can expedite the approval process, then of course patients will then be able to formally use them, and the HA can also introduce them into its drug formulary. But then, as you just said, under the 1+ mechanism, 19 drugs, I think 7 have already been incorporated into the drug formulary of the HA. Some have even been listed under the special drug category. In other words, as soon as doctors can prescribe them, then patients will only be required to pay them as if they are ordinary drugs. And we have also introduced this new cancer drug called fruquintinib. And then in the past, well, patients will have to pay more than $10,000 a month for that drug, but then after the system has been changed, all they need to do is to pay $20 for the use of that drug. And the HA would also be establishing a new office for the introduction of new drugs and medical devices, so that the time required would already be halved. With regard to R&D in Hong Kong, well, can the process be expedited? We are not specifically favoring Hong Kong drugs. We have to make it clear that when it comes to approval of new drugs and medical devices, we are not going to favor any manufacturers or any place or countries and so on. We will just be working on the basis of evidence. So we will have to make sure that they have been proven safe and effective. But then for Hong Kong people doing that, that would be somewhat faster, because you have to have a local base or database for that. Yes, Mr. Chu Lap Wai. After listening to the presentation with regard to the with regard to the reform of the drugs and medical devices evaluation and approval mechanism, I support this because many more patients will benefit from that. So I have two questions. First, para 13 of the paper says that since March 2025, the DH has already introduced the consultation service for new drugs application and so on. I'm sure these are drugs and manufacturers would like to get registered in Hong Kong. So I'd like to know how many pharmaceutical companies have consulted you, and where do they stand, and what are their concerns. Secondly, I can see that since the introduction of the 1+ mechanism, 19 drugs have already been approved. So I'd like to find out more. So on average, how much time would they need? And also how many people were involved? And also compared to the second tier or second evaluation mechanism, what is the situation under the 1+ mechanism and also under the future primary evaluation mechanism? What's the time difference required? Okay, so please be brief. Okay, I'll hand over to Dr. Lam. Yes, we also hope that the applicants, including those for innovative drugs, they would not be required to take a very convoluted route to get approval. So we have already incorporated innovative enterprises in the GBA. We have already briefed them on the application procedure and also the workflow. And then for individual categories, we have also organized workshops so that we can use our past experience, whether or not they are approving for the 1+ mechanism or the primary evaluation mechanism. So what we have seen in the past as to the possible hurdles or difficulties when it comes to documentation and so on, we will brief them. And thirdly, it would be somewhat it would be like a tailor-made service, so that there can be pre-application briefings and so on. In fact, well, a couple of them were very interested, and after we have met them face-to-face, I think we have introduced that for less than a year, and several applications have been received. In fact, they are preparing for the formal submission of application, but then for every detail before the submission, we would have to ensure that they know exactly what they are required to do, and they would also have to provide scientific evidence to do that. So for these 3 tiers of services, they have been compressed, and we have also launched a mechanism to assist the sector in making the application. And after that has been done, over 100 briefing sessions have been organized. So basically, there are 2 main categories. One would be multinationals, and pharmaceutical companies are very interested in that. And secondly, over half of those are from the GBA and the mainland, and many enterprises would also take part in such briefings. So our experience is that in the process of scrutiny, well, primary evaluation would be the most complicated compared to that under 1+ or others, because for primary evaluation, basically the data would already have been vetted by another recognized approval authority, and therefore in the process we would also be making reference to the comments made by the alternative or other regulatory authority. That would absolutely help expediting the registration process. But then for primary evaluation, we have just introduced that. We can see that it would require multidisciplinary assistance, and therefore in terms of manpower and also professional requirements and the time needed, well, for primary evaluation, definitely that would be a bit longer, and therefore we will review it after a while. At least one pharmaceutical company has already made an application for a pre-application meeting with us. So once they do that, it means that they have already they are about ready to make the formal submission. Next, Joey Chen. With regard to the new mechanism, can you give us the details as to the ultimate objective? Because the proposed amendment is just the first step, and then for the CMPR mechanism and also the fact that we're going to integrate both Chinese and Western medicine, that would come under the purview of the D of H. But then you also expect to submit the legislative proposal on medical devices by the end of this year. So I'd like to know, for existing medical devices, we have a voluntary registration system, and then for the statutory approval mechanism, the bill will be submitted by the end of this year. So what is your initial thinking on medical devices? How do you separate between medical devices and beauty devices? So it's already April. So have you got any initial view on this? Because in the past, it has always been very controversial. And also on the regulation of such devices, have you talked to this sector? So in the end, will such legislation be able to regulate both medical and beauty devices? Would that be made very clear? That's the second point. And also, the director also said, and it's also spelled out in the paper, that is for new drugs approval, you will only be completing the entire process by 2030. What about biomedicine and also state-of-the-art treatment methods? Well, for cancer patients and so on, their spending on drugs and treatment would be rather expensive. So is it that we do not have the expertise to do that, and therefore we will have to wait till 2030 before we can complete the entire process of primary approval? Because just now the director also touched on that. Well, for talents and also specialists, if we do not have enough talents for that, then we would not be able to expedite the process, because for such new drugs, they are very important to those patients who cannot afford the existing costly drugs. And also for the authorized sellers of drugs and also pharmacies regulatory mechanism after the amendment. So for those pharmacies or drugstores selling such drugs, what kind of change will that entail? Thank you. Well, Secretary, well, on the reform of regulation of medical devices and so on, is a very complex and mammoth job. Because in the past, for Chinese medicine and also Western medicine and medical devices and so on, well, they are separate. They are regulated under separate pieces of legislation, and now we are trying to integrate them so that they can be regulated under one umbrella legislation. And therefore, this body will become a statutory independent body. But then what about the ultimate objective? Well, the ultimate objective of the CMPR, the Center for Medical Products Regulation, it will be made independent in the future, so it will no longer be a government department, so as to establish its authoritativeness and also credibility. And people will have to attach importance to its work. And the establishment of the CMPR can expedite the process, and we hope to do that as soon as possible. With regard to the regulation of devices, as I just said, well, the existing legislation does not formally regulate them, and we have to do it. Because we would mainly be regulating medical devices, because as you know, well, there are many devices available in the market that are regulated under different pieces of legislation. But then what with including the trade beauty including beauty devices that are regulated under some existing legislation. But then in terms of talents, indeed we will also have to make sure that there are sufficient talents to do that. So beauty devices are currently regulated under the Trade Description Ordinance. And also for state-of-the-art treatment, for example, stem cell treatment and so on. But of course, many patients would like to give it a try, but then we have to emphasize the importance of quality, safety, and efficacy, because in the medical sector, we have to stay alert to the fact that we have to ensure that there will be new risk. We have to have sufficient database to support that is safe and effective, because in the past experience tells us that when new drugs come along, if the clinical data are not comprehensive and reliable, then new drugs can bring about disastrous outcome that can harm the health of our public, and therefore we have to be very careful about that. And therefore, for regulation of pharmacies and so on, I'll leave it to the director.
As we draft the legislations, we drew reference from international experiences as well as standards. For most economies in the world, with respect to regulation over pharmacies or relevant premises, it is the government that is responsible for that. And by rolling out the legislative amendments, we'll be able to truly align with international standards. Also, I'd like to supplement that it is our goal to see full implementation of primary evaluation by 2030 according to our roadmap. But our principle is that we want to tackle the easy matters first, and we are slowly building our professional team. We have the support of the national administration, and we also have the 2 GBA centers set up by the national administration that helps regulate drugs and medical devices. At the national level, the approval center in Beijing allows our colleagues to receive training there. So we hope that through multiple means, for example, overseas recruitment as well as enhanced training and collaboration with the industry and universities, will be able to speed up the implementation of the primary evaluation mechanism. Will the disciplinary mechanism change for Chinese medicine practitioners? The CM Disciplinary Board is composed of public officers as well as members of the sector. The future composition of the board, we will draw reference from the existing mechanism. Next, Ms. Grace Chan. I support the proposals made by the administration. I'm looking at paragraphs 39 and 40 of the administration paper. I see that most of the power will be concentrated on the Director of Health in the future. I don't see how the administration will deal with complaints. I know that there will be appeal mechanism as well as relevant tribunals in place, but will there be ways for people to lodge complaints in relation to drug safety? Secretary, the existing registration system covers Chinese and Western medicine as well as medical devices. We have various legislations that help govern these. We hope that with the legislative amendment, we can have all these dealt under one roof. The Director of Health, that is the head of the authority, will have power to oversee all these. As for our approval mechanism, it will not affect patient groups or patients. This is because all these drug registration applications are submitted by or initiated by pharmaceutical companies. This is because pharmaceutical companies that own a certain type of drug has the decision-making power to decide where they want to submit the registration, and this has nothing to do with patients or patient groups. Ms. Chen, any follow-up questions? Just now we talked about how the approval and evaluation of drugs are crucial to the benefit and well-being of patients and members of the public in general. I want to know how patients can take part in the process. As mentioned, but patients will not take part in the approval and evaluation process. But I guess your question is, when safety issues arise, how would the administration follow up? Secretary, any drugs that are approved and evaluated under the existing mechanism and can be used lawfully in Hong Kong, the future CMPR will be responsible for monitoring the approved drugs or medical products. Say there are any complications that arise, even not in Hong Kong, in other places instead, the future CMPR will closely monitor the effects of the drugs concerned, and it will decide whether it is necessary to recall or even suspend the use of the drugs. Mr. Peter Xu, the National 15th Five-Year Plan clearly states that we need to steadily open up ourselves and align with international standards. We have to enhance our trade standards, and this means that instead of passively following national strategies, we have to proactively dovetail with national strategies. The opening up of our systems will drive high-quality development. Today's discussion is about the reform of drugs and medical devices evaluation and approval mechanism. And there will be the new Center for Medical Products Regulation. And this echoes with the national strategy and overall direction of our country. So I speak in support of the administration's proposal. Thanks to the administration, there were 2 to 3 discussion meetings between members and the administration. The PowerPoint presentation was rather complicated. I don't think general members of the public could understand the proposed organization or structures. So thanks for your explanation. My question is, there will be new drugs and medical products in Hong Kong. Of course, we will draw reference from international standards. But what if we're talking about novel drugs and medical products that are used in Hong Kong or by our country first? How can we set standards and convince other places to use these drugs or medical products? Second, as discussed before, medical devices cover beauty devices or aesthetic devices. The beauty industry is worried how the government will distinguish medical devices and beauty devices, and what kind of beauty devices can be used by beauticians. I don't think we have to worry about it at this moment, but I hope that the future Center for Medical Products Regulation can communicate with the relevant industries about this. Secretary, the approval of medical products, it's rather complicated because it involves very professional drugs and medical devices, and we have to abide by very high standards when we look at the development process of the medical products. I understand that general members of the public may not understand the procedure. So what we have to do is that we have to develop a system. We have to make sure that there are enough experts who are familiar with the entire process and who can help gatekeep the quality and safety of the medical products. The procedure is complicated, and that is exactly why we have to come up with standards. We will set out these standards in detail, so members of the public need not worry about this, and because we have experts who deal with this. You mentioned that different places have their own standards, and that include our national administration. We are reforming the drug approval and evaluation system. And so we are going to establish another level of authority. We will make use of our advantages under one country, two systems. The medical products we use are of high quality, and we have gained international recognition for the medical products we use. And we shouldn't just focus on drugs or medical products developed by our country. Medical products developed around the world, they may, through the approval mechanism in Hong Kong, register their medical products in Hong Kong so as to speed up the approval they get in other places or to gain recognition around the world. And to answer your other questions, I will say again that we are only regulating medical devices for this legislative amendment. We are not going to look at non-medical devices used by other industries. However, we have to be careful. If there are industries that make use of medical devices, then we have to look into the matter. But please rest assured that we will consult all relevant stakeholders for our legislative amendment. Next, Professor Chen Wing-Kwong, I support the establishment of the new regulatory center. The PPB have various committees, and the CM Council also consists of various committees. And to restructure the two councils, it involves a lot of manpower. How can the administration make sure that the various committees can work together so that we can achieve greater synergy? Now, I'd like to ask again about the regulation over medical devices. We understand that many non-healthcare industries are making use of medical devices. For example, centers that claim to tackle pain diseases, as well as beauty industries that are making use of medical devices. In future, how can the administration regulate the unlawful use of medical devices to better protect citizens? Also, according to the paper, since 2023, the government has launched the primary evaluation mechanism and 1+ mechanism, and 19 new drugs have been approved under this mechanism. How long did it take for the administration to approve these 19 drugs? Did the administration assess the effectiveness of the 1+ mechanism since its launch? Is there room for further improvement? Now, with the 1+ mechanism, we can make sure that good drugs can be used in Hong Kong and that we can strengthen our approval capabilities. So will the government see full implementation of the primary evaluation mechanism earlier instead of waiting until 2030 so that we can have more new drugs approved and that we can benefit more patients? Secretary, the last question is about 1+ mechanism, and I actually replied to this question earlier. Our pledge is that the new drugs can be approved within 150 days, given that all documents can be submitted. And the 19 drugs approved, they were all approved within 150 days, so we were able to meet our target. To answer your question about whether we can see full implementation of primary evaluation earlier than 2030, well, of course, we want to see full implementation earlier, but this is a very complicated procedure, and this has to do with the safety, efficacy, and quality of the new drugs, so we have to be a good gatekeeper. As mentioned in other economies, it took them 10 years to roll out primary evaluation, so our current roadmap and timetable are already very aggressive. Now, we have existing legislations that help regulate the use of non-medical devices for Western medicine practitioners or dentists that need to use medical devices. There are existing legislations that regulate these. Now we are talking about regulation of drugs and medical products. So we're not regulating the practitioners, instead we're regulating the products. In relation to the question about manpower, I'll defer to Mr. Lam. The member asked about manpower. And this is why we have to amend our legislations in order to establish the Center for Medical Products Regulation, because we want to provide a new statutory positioning for the new center, and it will be under the Department of Health, and most of the manpower would come from the Department of Health in order to attract various types of experts. Thanks to LegCo, we were able to create 4 new directorate posts, and in this coming year, because of the primary evaluation implementation, we are creating 30 other new posts. So we are adding manpower. In terms of the restructuring of the Department of Health, we have been working on that, and we have been consolidating the various posts so that we can align with international standards as soon as possible. I believe that with our team, there won't be too many challenges or difficulties. Next, Ms. Christine Fong. The National 15th Five-Year Plan clearly supports the development of ourselves into an innovative health care hub. I speak in support of the establishment of the Center for Medical Products Regulation. I also support the creation of 4 directorate posts under the Department of Health. As mentioned, we will see 30 more officers working under the DH. I understand that it's not easy to take forward the primary evaluation mechanism because it involves a large quantity of clinical data. In other places, to obtain clinical data and to approve drugs, it may take less time and it may incur less money. So I want to know how we can improve our primary evaluation mechanism in this regard. Also, will there be a dedicated task force to be set up by the administration so as to enhance the safety of drugs and the monitoring of data so that we can transform our data into safety? As mentioned, the ICH is a world-recognized body, so how can we dovetail with international standards? Also, there was mentioned about the Northern Metropolis. I understand that the Northern Metropolis is not linked to the new CMPR, but you have been inviting various kinds of experts to your briefing sessions. Will biotech or medical products and the relevant industries be turned into a real industry with the development of the Northern Metropolis?
Secretary, on clinical data, well, in the process of clinical trial, indeed that would take some time and it would also be rather costly. But then in developing the clinical trial center in the Loop area and also the clinical trial center in Shenzhen, well, precisely, we are making use of such a mechanism to expedite the clinical research process. So long as we can expedite that process, we will then be able to ensure that the entire clinical trial process's costs can be lowered. As a result, more drugs can be put onto the market at a lower cost. And then for the Northern Metropolis, I have to reiterate that for new drug registration, it doesn't depend on the development of the Northern Metropolis. And of course, the Northern Metropolis development will ensure that biomedicine, and there is a lot of room for new and innovative drugs to be developed, and they can all be done in tandem. Finally, it's my turn. Well, given the existing measures and policies, if new drug has to be approved, then they will have to go through the PPP's committees, and then they will have to have meetings before such new drugs can be approved. Once that's handed over to the Department of Health, so the PPP will then become an advisory body. So under those circumstances, do the existing committees under the PPP have to deliberate on such drugs, and then advice be given to the D of H before approval can be made or given? So what will be the new process? Can you elaborate a bit on that? Well, let me briefly say a few words on that, and then the director can supplement. You talk about the PPP's mechanisms. They have committees to scrutinize new drugs. Under the existing mechanisms, they have experts sitting on those committees to scrutinize new drugs before they are approved. Well, after that has been incorporated under the CMPR, the PPP's committees will then become an advisory body. So CMPR will be the authority that will be receiving advice from those committees under the PPP, and then the CMPR will decide whether or not a drug will be approved. And of course, the Director of Health will be the ultimate authority to make that approval. And therefore, the whole process will not be slowed down whatsoever. Indeed, under the reform mechanism, including the 1+ mechanism and consultation process, will be more proactive in scrutinizing new drugs, and more experts will be put together to scrutinize the applications. Director, anything that you'd like to add? Well, as the Director of Health, and at the same time, I'm also the chairman of the PPP, the Pharmacy and Poisons Board. Well, in terms of the transfer of power, it's done under the legislative mechanism, and therefore that would be very much aligned with the international mechanism, because I'll be wearing two hats. I'll be the chairman of the CMPR as well as the chairman of the PPP, and whatever is whether it's under the new or old mechanism, experts' advice will be very important. We have the Academy of Medicine and also the universities, and they've been working with us. We have put together experts from over 3 to 10 categories, and they have been working together to look at new drugs depending on their categorization and nature, and then they will set up panels to study the new drugs. And what I've seen is that, in the past, the first thing that they had to do would be to submit the application to the PPP for scrutiny, and after the amendment of laws through the consultative mechanism, they can also get the advice from the experts, and very often it depends on the nature of the drugs that they are applying for. And that would also have to do with the pharmaceutical route, whether or not it will have any impact or implication on human health and so on. Well, in the end, it's always the experts who will act as gatekeepers, and then we will listen to their advice before making any decision. Okay, thank you. So I think we'll wrap up our discussion here. Yes, do members support the legislative proposal by the government? Yes, thank you. Thank you very much for attending our discussion, for attending the meeting on this item. Next, we have the next item. That's the new mechanism on the legislative proposal to implement plain packaging requirement on conventional smoking products and update on the duty stamp system. Let's invite the administration team to join us. Okay, we have the Secretary for Health, Professor Lo Chung Mao, Mr. Eddie Lee Lik Kong, Deputy Secretary for Health, and also Mr. Dr. Manny Lam, Head of Tobacco and Alcohol Control Office, and also Mr. Ng Chanwa, Assistant Commissioner from the Customs and Excise Department, and Ms. Jacqueline Lee, Staff Officer from the C&E Department. This has to do with legislative proposal, and therefore we have also invited all members to join us to discuss this. And for those who would like to speak, please press the request to speak button. And now I'll hand over the floor to the administration. Yes, Secretary. Chairman, this term of government's smoking control objective is very clear, and the target is also very clear. And I'm here to introduce, to brief you on 2 new measures to be introduced under the 10 short-term tobacco control measures. I'd like to just update you on the effectiveness of the existing measures. According to the Census and Statistics Department's data during the by-census last year, well, Hong Kong's smoking rate has already come down from 9.1% in 2023 to 8.5% in 2025. This is a historic low. And then when compared to before the pandemic, it's 10.2%, and 2021, 9.5%, and then 2023, 9.1%. Our smoking rate has continued to drop, and between 2023 and 2025, there was a significant drop. In terms of the number of smokers, in 2025, the number was 538,100. When compared to the situation before the pandemic in 2019, there was a drop by 100,000, and also the number of cigarettes that they smoke on average on a daily basis, there was also a significant drop in 2019 to 2021. Well, that's 12.7 cigarettes a day, and then by 2023, it's 12.1 cigarettes, and then between 23 and 25, it dropped to some 10.9 cigarettes per person. So in 2 years' time, there was a drop by some 10%. And the number of smokers has come down, and also the number of cigarettes that they smoke on average has also come down, and therefore the number of cigarettes that have been sold would also dropped by some 30%. In 2023 to 24, smoking duty increased by some 73.5%, and the record that we have collected show that by increasing cigarettes price, that would also help to suppress the number of smokers. The smoking rate has also come down with the continuous drop in smoking rate. It shows that the evidence-based approach adopted by the government has been very effective, and through different control measures in different sectors, including the increase of smoking duty, and also the promotion of smoking cessation services and so on, we have successfully reduced the harm of smoking, and 100,000 less smokers are there, and that would also help reduce the number of those suffering from smoking-related diseases, and that would also help boost the happiness of families, and some 7.5 million people would also not be subjected to the smoking harm. But then it's a continuous process, and we cannot afford to slow down, and therefore we will have to roll out different measures, including conventional smoking products. We are going to introduce plain packaging, and also we are going to introduce this duty stamp system that is to reduce the attractiveness of smoking, and we would also be effectively clamp down on illicit cigarettes. We have already controlled the advertising of cigarettes and so on. Well, for any pictorial advertising, that would also be confined to that would be no more than 15% of the packaging. But then manufacturers are continuing to attract smokers so that they can be distracted from the smoke control or smoking warning. And therefore, we have made reference to some 25 jurisdictions on this, and therefore we have now come up with a proposal to introduce subsidiary legislation on plain packaging requirement, because evidence shows that that would also reduce the attractiveness of cigarettes, and that would also effectively lower smoking rate, and that would also help reduce the number of youngsters smoking. So, well, for little cigarettes, they will also have to adopt a plain color, and they will only be able to display the brand name, variant name, and details of manufacturers and so on in a specified manner. And we will also be gradually we will review the 12 warnings that have been introduced since 1985 in order to ensure their effectiveness. And in promoting the amendment, we would also give priority to combating illicit cigarettes. In other words, we are going to introduce the duty stamp system. In other words, they would also have to put up, they would also have to have the stamp on the packaging in order to show the differences between duty stamps and also the so-called cheap whites in the market. We have completed the review in March this year, and we have also maintained very close liaison with the sector. And after taking into account their advice, at a very major event this year, we have formally announced the specifications on the packaging, and we have also given samples to the sector for reference in order to ensure that they don't have to make two changes in two separate moves. So we're going to introduce them in an orderly manner. And we have also taken into account the needs of the stakeholders. We have also offered a 13-month preparation period and 9 months transitional period, a total of 22 months. So when compared to previous changes, we're giving them 8 to 12 more months to prepare. So the relevant matters have been announced on the 29th of January this year, and the consultation period actually lasted for some 13 months, and manufacturers can start to make preparation about 2 months ago. And the transitional period will also start in March 2027, lasting for some 9 months. And then manufacturers and also importers and exporters should have enough time to make adjustments to the manufacturing line and also the packaging in order to ensure that the duty stamp would be put on the packaging in order to replace the conventional packaging. And at the same time, both the public and the retailers can also adapt to the new arrangement. And these measures will formally come into effect on the 1st of October 2027. By then, only those who are able to meet the requirements on the plain packaging and also the advertising and so on will be able to sell these products. So I have to emphasize that 22 months preparation and transitional period is a reasonable timetable that has already met the requirement of smoking control and also the manufacturer's needs. Under the roadmap, the manufacturers have the duty as well as the time to prepare to meet the latest requirements, and then they can also fully implement the measures in accordance with the new requirement. I welcome your advice. We have the representative from the DFH as well as the C&E department here to answer your questions.
Thank you, Secretary. Before this meeting, the Secretariat received 8 submissions in relation to this topic, and the submissions have been circulated to members before the meeting for their reference. Now I'll open the floor for questions. Time is limited. I'll give 4 minutes to each member, including questions and answers. I'll read out the lineup. Professor Chen Wing-Kwong, Mr. Adrian Ho, Mr. Kitson Young, Mr. Tommy Chong, Mr. Mark Chong, Mr. Peter Xu, Mr. Chen Pui Leung, Reverend Peter Kun, and Ms. Rebecca Chen. 4 minutes for each member. Professor Chen Wing-Kwong. Thank you, Chairman. Any measures that can help reduce the smoking rate and can offer protection to members of the public, I support them. I have the following 2 questions. After the implementation of the plain packaging requirements, what does the administration expect to achieve? For example, how much will the smoking rate be able to be lowered, and will that stimulate members of the public to quit smoking? Can you provide relevant statistics? Also, I understand that the CNED has explained to members of the public as well as retailers about the duty stamp system. However, according to paragraph 27 of the paper, during the transitional period, 3 types of cigarettes will exist on the market at the same time. Also, according to a recent survey, 80% of the citizens do not understand the duty stamp system. So how will the administration explain to the public about this new arrangement so that no one will be caught inadvertently by the law? Also, illicit cigarettes and regulated cigarettes are very different in terms of their price. So how will you make sure that citizens will not risk to buy illicit cigarettes because they are much cheaper? I will ask Dr. Manny Lam from TACO to respond to part of the questions. As for the duty stamp system, I believe that Mr. Chun Hua from the CNED can respond. Dr. Lam, concerning the plain packaging requirement, back in 2012, Australia was the first country that implements the requirement. So statistics show that it is effective. For example, in Australia, after the requirement is implemented, within 3 years' time, the smoking rate reduced by 0.5%. And we're talking about smoking rate lowered because of this requirement. And so the smoking population dropped by about 108,000. Also in Australia, the number of people who tried to quit smoking rose from 20 to about 26%, and there was an increase of 78% in terms of the number of people who called the quit smoking hotline. Also, studies show that the plain packaging requirement can lower the attractiveness of cigarettes, and it shows that the requirement can lower the number of young people who try smoking. I believe that we can yield the same effect in Hong Kong after implementing the requirement. Secretary, anything to add? No. CNED? Thank you, Secretary. Thank you, Chairman. Concerning the duty stamp system, the first phase will be rolled out on the 1st of March next year, and we will see full implementation on the 1st of December next year. The member said there will be 3 types of smoking products on the market that cover products without the duty stamp. There are also going to be products with the new duty stamp. So there will be in total 3 kinds of packaging appearing on the market during the transitional phase. Moving forward, we will continue to talk to the relevant industries about the implementation of the duty stamp system. Also, we will launch publicity campaigns, for example, on various social media platforms, and on various media platforms we will launch publicity campaigns to ensure that members of the public, as well as tobacco traders and retailers, will be familiar with the duty stamp system. So in the coming few months, this is what we're going to do. Chairman, I'd like to supplement. Any such changes require a transitional phase, and this is necessary. I'd like to ask Mr. Eddie Lee, Deputy Secretary, to explain more about the 3 kinds of smoking products that will appear on the market. Just now the member said he was concerned there will be 3 kinds of smoking products with different packaging on the market during the transitional period. I'd like to point out that it is exactly because of this that we are going to roll out a rather long transitional period and a long preparation period. We believe that with the longer transitional phase, tobacco traders will be prepared to roll out the new packaging. According to the paper, there will be 3 types of packaging on the market during the transitional phase, but we believe that with such a long preparation period, we believe that there will only be 2 types of packaging on the market, that is, the original packaging as well as the new packaging. We want to avoid any chaos. This is why we are going to have a longer preparation and transitional period. Next, Mr. Adrian Ho. I have 4 questions. According to the new plain packaging requirement, it will apply to conventional smoking products as well as little cigars. How come larger cigars are not included in the new requirement also? after the rolling out of the requirement, the appearance of all kinds of smoking products will look nearly the same. How will you enable consumers and retailers to identify the different brands? Also, the requirement to include tar and nicotine yields on the packaging will be removed. So how will consumers detect the risks of these smoking products, and how can you ensure that scientific information about this kind of smoking products will be provided to the public? Also, some consumers opt for certain smoking products, and this shows that the pictorial health warnings pose a deterrent effect. So will you make sure that there will be enough warning in the pictorial health warnings so as to enhance the effectiveness? Secretary, I will first respond to the last question because it is an easier question. I am happy to see that members of the public are worried about having gangrene after seeing the pictures. Not just gangrene, but smoking can cause cancer as well as oropharyngeal cancer or diseases. So I hope that you can all help to spread the message that smoking can cause many health issues, not just gangrene. Now I'd like to ask Mr. Eddie Lee, our Deputy Secretary, to respond to the other question. About the plain packaging requirement, we discussed this in the previous Bills Committee, and on various occasions members asked us about larger cigars. Concerning larger cigars, indeed, they are sold or packaged in a different way compared to little cigars. And so, because of operational issues, we will need more discussions in order to incorporate larger cigars into the new arrangement. So we're going to adopt an incremental approach. We're going to start with conventional smoking products as well as little cigars for our plain packaging requirement. As for low tar and low nicotine signage, the WHO is of the view that this kind of packaging would cause misconceptions. This is because the low tar and low nicotine products could also cause health issues to consumers. Therefore, to align with international practice, we're going to remove the requirement of including tar and nicotine yields on the packaging. So how can you ensure that consumers will not buy the wrong product? We're going to roll out two measures at the same time, the plain packaging requirement as well as the duty stamp system. Regarding the duty stamp system, the CNED is incorporating several layers of anti-forgery features. Just by naked eye, you will be able to identify fake products from genuine products. There will be ultraviolet features and patterns printed on the stem, and it is like those features on banknotes, so you can easily identify the authentic products. Also, there will be a digital verification system. So this is to offer protection to members of the public. Next, Mr. Kitson Young. Before Mr. Young speaks, I'd like to remind members that I'm going to draw a line after Mr. Kitson Young has spoken. Mr. Yang, please. Thank you, Chairman. I support the plain packaging requirement as well as the duty stamp system. However, I have a couple of questions for the Secretary. First, as mentioned by the administration, the plain packaging requirement can help lower the smoking rate. While the administration is going to regulate the packaging, well, sometimes when we get cigarettes, we get a free lighter or a free pouch. This is to help promote smoking products too. If we do not regulate this kind of promotional tactics, the packaging requirement will not be very effective. Second, about the duty stamp system. There have been duty-free cigarettes that are brought to Hong Kong from other places. Without a clear regulatory system or a clear way for people to identify the duty-paid cigarettes and non-duty-paid cigarettes, say there are cheap whites from other places brought to Hong Kong, how can you ensure that members of the public will not accidentally buy cheap whites?
Secretary, well, I'll answer the second question first. Under the existing legislation, well, for duty-free cigarettes that can be imported to Hong Kong, that has been limited to 19 cigarettes. So individuals can bring in some 19 cigarettes, but then that cannot be used for sale. So that's the existing restriction. And if they'd like to bring in more than 19 cigarettes, then they will have to make a declaration with the C&E department, and the Customs and Excise will collect duty on the spot. And the number would also have to be reasonable. And then a duty stamp would also be affixed to the packages of the cigarettes, and therefore that's the existing arrangement. And the Deputy Commissioner can also explain the details. As to sending that out as a small gift, well, the Smoking Control Office can also explain to you, because that would not be permitted. So I'll defer to Dr. Lam from the Tobacco and Alcohol Control Office. Under the existing ordinance, in terms of advertising on cigarettes and so on, there are very stringent regulations. Basically, no advertising is permitted. And when you sell tobacco products, that can also not be connected or linked with other gifts or presents. So that cannot be done as a package with other commodities. Yes, Assistant Commissioner. With regard to the duty stamp, well, if any travelers bring in a certain number of cigarettes more than the permitted number, then they will be charged a stamp duty. And then after they have paid the duty, then there would be a sticker fixed to the package, and the color would be somewhat different, and therefore we can distinguish between those that have their duties paid and those that have not. So such cigarettes cannot be put on sale in the market. We have already tested with the arrangement, and the operation has been smooth. Yes? I'm not suggesting that it's a gift. For example, if they are given a bag which contains the cigarettes, would that be okay? Because the bags could also become an advertisement promoting the tobacco products. Yes, I understand that the law provides that only 19 cigarettes can be brought in, and then anything in excess of that will have to pay duty. And then there would be no need for the packages to be changed, so long as you have the stickers on it. So let's say if an illicit trader is selling cheap whites, and then if they tell you that, well, if you are searched, then you can just say that it's duty-free cigarettes because I bought that in from elsewhere. It's okay. But then when you try to combat illicit cigarettes, when you try to combat cheap whites, then how are you going to plug this loophole? If you're not able to do so, then what's the purpose or meaning of introducing this new mechanism at all? Well, what I'd like to say is, well, when we try to combat cheap whites or illicit cigarettes, I think it's at the sales outlets that we're trying to do something about it. At present, we are not suggesting that any individual having a package of cigarettes and smoking, then we will just catch them and say that the packet of cigarettes that you have is illegal. So we're trying to combat that at the sales outlet point and also through other channels. So for the details, I'll defer to the Assistant Commissioner. Yes? Well, with regard to the 19 cigarettes cap, so if a traveler brings in 19 cigarettes, then he will be able to bring that in duty-free. But then he will also have to make sure that they are checked, because the purpose of introducing this 19 cap is to make sure that they cannot bring in a whole pack of cigarettes. As to whether or not they can sell them in the market, I don't think that will happen. And indeed, in Hong Kong, when you sell cigarettes, you cannot sell individual cigarettes. You will have to sell a package of cigarettes. So that's over 24 cigarettes in one pack. And therefore, having duty-free cigarettes sold as duty-free cigarettes would not happen. Yes? Mr. Chong Ho Fong. Yes, I support the proposed system with the introduction of the plain packaging and also the duty stamp system, and comprehensively introducing them well, on the 1st of October 2027 would give you sufficient time to prepare for that. I support that. And para 21, you also talk about the digital mark, that is to enable the law enforcement agencies to enforce the law. But then can you also introduce new functions on the smoking cessation app so that members of the public will be able to find out whether or not these the cigarettes that they have on hand are illicit or not, and that would also help enforce the law more effectively. Thank you. Well, I'll defer to the Assistant Commissioner. Thank you. So can there be live well, we have a live tobacco forum for that. Well, we have this physical marker on the packaging that is to enable members of the public and also the retailers to immediately distinguish whether or not they have paid the duty for the cigarettes. So it's almost like the currency notes that we have. Well, I believe that people do not have to have them checked by a device. For example, they can use the watermark, and also they can use ultraviolet lights to detect whether or not the invisible ink on the currency note is real, is authentic. So I think consumers just need to go to an authorized retailer, and then they'll be able to buy duty-paid cigarettes. And then as the law enforcement agency, we will have to find out whether or not this pack of cigarettes has had its duty paid, and whether or not the sticker on the cigarettes or on the pack is authentic. So we do need to have certain devices before we can find out. But then according to the sector, they may not know exactly where these packages or packs of cigarettes are from, and therefore they may need some help, and therefore in the design, we have already decided to use certain devices to do the authentication, and we have initially procured some 500 such devices, and they can be lent to the stakeholders if they are not rest assured. But then, if they think that the marks are not, they are not sure about the authenticity of the marks, then they can use those devices to verify. Okay, it's already 12:37, and we are scheduled to end by 12:45, and we still have 6 more members who would like to speak. Can I extend the meeting by another 15 minutes to ensure that all members who would like to speak will have the chance to speak? Okay, agreed. Okay, next, Chong Ho Fong. Thank you, Chairman. Well, our group has always been in support of your smoking control policy. So I'd like to seek further details on this. Well, you talk about plain packaging of cigarettes, and you have also set out the requirements, including the brand names that cannot be more than 1 row, and also the Chinese English would also have to use specified fonts and size, and the color would be plain tone, Pantone 448C and white and so on. But then in terms of the packaging, there are so many elements, and on each and every one of them, there are very detailed requirements. So how can you be sure that they would be able to comply with that 100%? Does that mean that they will have to give you a sample for approval before they can manufacture that in large quantities? And also in the paper, you also said that anybody will not be permitted to sell conventional tobacco products unless they have been in full compliance with the latest requirements. So what about convenience stores and also newspaper vendors? Before they sell tobacco products, do they have to check whether or not the packaging are in full compliance with the latest requirements? But then it would also be hard for them to find out if each and every requirement is met. And also with regard to the duty stamp system, para 18 says that between May and January. Between May 2025 and January 2026, they have conducted a trial, and the compliance rate was 99%. So is it because of your modesty that you say that it's 99%? And what about the 1%? Have you been able to resolve the problem? Would that become an obstacle to the full implementation of that? With regard to the plain packaging and also the sales outlets and so on, I'll defer to Dr. Lam from the Tobacco and Alcohol Control Office. And then for the rest, I'll defer to Mr. Ng Chanhua from the C&E Department to answer. Yes, Dr. Lam, on the packaging requirement, to ensure the manufacturers will know very clearly what the requirements are in the future legislation, we will give very detailed specifications. For example, the location of the marks and also the size, the colors, and so on. Well, in overseas jurisdictions, there has not been any difficulty in complying fully with the requirements. And also, in the future, I think it's about the first time when the manufacturer manufacture the products or the packages. If they have any doubts about the packaging, they can always check with us. Next, Assistant Commissioner, on the pilot scheme. Well, for the duty stamps, the success rate was 99%. Well, 1% represents fail or failure. Well, the reason why they failed, that's because the C&E was there to monitor how they stick the stamps on the packages. As you can see, the machines doing the packaging would be doing it very quickly, and therefore in the process there would also be a certain percentage of damaged packages, because even if you manufacture the products, in the packaging process, there are always packets that have been damaged in the process, and therefore in this case, there were also duty stamps that have not been successfully affixed to the packages. But then when we did the pilot program, it was done during a very short time, and only very short time was given to the manufacturers to prepare for that. And I'm sure after they have done it for a while, after experience has been accumulated and the machines are properly calibrated, I'm sure the success rate will be even higher. So by the time when it's fully implemented, I'm sure they would be able to do so 100% successfully. What about convenience stores and also newspaper vendors? Who has the duty to check? Well, in the future, after full implementation of these requirements, well, for any tobacco products that are sold in the market, they will have to pay the duty, and therefore retailers will have to make sure that the tobacco products that they sell have already paid the duty, and that's something that they will have to pay attention to. With regard to the stamps, as to how they would appear on the packets, well, basically, there will be authentication marks on the stamps, and they can tell whether or not it's a real stamp. It's almost like the currency note that we have. An average citizen will be able to tell if it's authentic, and therefore basically they do not have any extra duty to do anything extra, so long as they make sure that there are stamps affixed to the packages of the tobacco products. That's okay. Next, Siu Ka-fai. Thank you. Well, the government wants fewer people to be smokers so that they can enjoy better health. I think I can appreciate that. As to what you do to achieve that purpose or objective, that's for you to decide. I think there are two things here. First is about the cheap whites. So you will have to affix a duty stamp on the packages. And next is about the plain packaging. Well, with regard to that, I've had many meetings with the CNE, and I've also talked to the trade. Initially, well, by the 1st of July 2027, you're going to implement it in full. But then after listening to the views from the sector as to how it actually works, well, they have extended it, and I welcome that. And they said that they would also be working harder to comply with the latest requirements, including the watermarks and so on. With regard to plain packaging, they have got some views. The initial objective is to have plain packaging so that people will not be attracted to buy those cigarettes and smoke. So the objective is to reduce the number of smokers. But then other than the appearance, in terms of the size and everything, you have also regulated that. In other words, if they want to buy longer cigarettes and if they want to buy smaller or bigger packages, like having more 20 or 25 cigarettes in one packet, they will not be able to do so in the future. And you have also got this silver lining in the packs, and you're proposing that you will have this matte silver inner paper in it. Well, these are not major things. I hope that you can consider the views. With regard to cigars, well, I can understand your proposed regulation because cigars are rather expensive, and if there are no authentication marks, they would find it hard to comply, and therefore you have exempted them, and I would agree. But then for those selling small or little cigars, they said that they cannot be exempted. But then they say that the sales volume in Hong Kong is not that big in Hong Kong, and therefore they cannot expect that manufacturers will be having new packages just for them, and therefore can they be exempted as well, or they can just put in some inlays in order to meet your requirements, or else the little cigars can no longer be sold in Hong Kong if you insist on this new requirement. So the stakeholders have given you the suggestion, and you also told us that you'd be relying on scientific data to evaluate the effectiveness. Well, for 2023, well, the smoking rate was 9.2%, and now it has dropped to 8.5%, and therefore you have managed to reduce that by some 66 percentage points. And this term of government expects that to come down to 7.5%. In other words, right now it's 8.5%. You haven't met the requirement or target. Why is it so? And also, secondly, in terms of the smoking rate, well, it's been down by some 6.6%. But then in terms of the effectiveness, well, back in 2023, well, if at the time it's 72.5, and then for 2 consecutive years, you've actually increased that by some 30%. And this year, well, the duty that has been collected amounted to some $5.5 billion. And then you said that because it was the pandemic and people would not be able to cross the boundary to buy cigarettes, and therefore the figures might not be accurate. And therefore, I tried to look at the 2017 figures. Well, in 2017, well, you used to collect $6.3 billion, and if you multiply that by the figures, then it should have been $10.9 billion. So it's about $1.1 billion, and compared to the existing revenue that you collected, actually it has dropped by half. So you have only managed to cut the number of smokers by 6.6%. Does that mean that actually many more people are buying illicit cigarettes?
Secretary, the member mentioned many complicated figures. I'm not sure if we understand, but I want to say that tax revenue and the actual smoking rate can be affected by many factors. For example, there are people from Hong Kong going to the mainland, so there might be a high number of lawful duty-free cigarettes coming to Hong Kong. According to our latest figures, we're seeing a drop of about 30% in terms of the number of cigarettes used, and the smoking rate dropped from 9.1 to 8.5%, which represents a drop of 100,000 people. And each person smoked 10% less in terms of the number of cigarettes. So this is a clear achievement we have accomplished. You said our goal was to reduce the smoking rate to 7.8%. Does that mean we're not meeting our target? Well, I want to say that the 7.8% target is not set by the current term government. The World Health Organization in 2018 came up with this target. We used the smoking rate in 2010 and we deducted by 30%, and that's the smoking rate targeted. And so back in 2018 we used 2010's figures as a base to come up with the target rate we want to meet by 2025. It would be a 100% success rate if we're able to meet the target of 7.8%. I would say that we're not getting 100 scores in terms of our target rate by having smoking rate at 8.5%, but I would say we're getting a score of 85 to 95. Also, the WHO, because of COVID, is reviewing the target they set in 2018, that is to drop the smoking rate by 30% by 2025. Now, as for the other questions, I'd like to ask Dr. Lam from TACO to explain. Just now, Mr. Peter Xu asked about the regulation over cigars. In future, in relation to the specifications for the packaging of little cigars, they will have to be more or less the same as conventional smoking products. That is, in terms of the color as well as the materials used for the packaging, they will have to be similar to that for compared to conventional smoking products. But the specifications may be a little different. For example, the dimensions for the package or the packets for little cigars will be a little different. Drawing from other countries' experiences, we're going to ask the packets to be in square shape, and the dimensions could not be smaller than 8.5 millimeters times 8 millimeters. Also, currently, we ask conventional smoking products to be packed in cardboard, but we will allow the metals to be used for little cigars. A lot of times there are inserts in the packages for little cigars to protect little cigars from getting damaged during transport. So we will allow for these kind of inserts in the future. As for pictorial health warnings for little cigars, 70% of the surface will have to be covered on the front of the packaging for little cigars. And in the future, we will allow for stickers to be included in the packaging. So the specifications for little cigars will be different from those for conventional smoking products. Yes, Mr. Xu. I hope that you can talk to the tobacco traders who sell little cigars. Your original purpose is not to prevent traders from selling this kind of products in Hong Kong, right? I hope you can communicate with them about the packaging, because I don't want little cigars to be eliminated from the market in Hong Kong. Next, Mr. Chen Pui-Leung. I speak in support of the plain packaging requirements as well as the duty stamp system. I have two questions about the operational details. Currently in Europe, there are EU identification code printed on the packaging of smoking products manufactured in Europe. If the track and trace identifier can only appear on the packaging once, then internally for the production line, they'll have to have a QR code in order to make sure that the duty is paid. So will the administration consider having one more kind of stamp for track and tracing purposes? Second question about differentiating genuine products from fake products. You mentioned that with ultraviolet light, you'll be able to identify the authenticity of the duty stamp. However, for normal citizens, if they want to get a pack of cigarettes, they won't carry with them ultraviolet light. They won't be able to tell by naked eye the authenticity of the duty stamps. So will you think of ways, for example, by scanning the duty stamp through a mobile app, you'll be able to tell the authenticity of the duty stamp so that people will not inadvertently buy cheap whites? Secretary, to respond to your last question about duty stamp, it is a physical anti-forgery feature that we're talking about, so you can tell by naked eye. You don't necessarily have to use ultraviolet light. It's like telling whether a banknote is fake. You can tell by naked eye. Same for the new duty stamp. You can tell by naked eye whether it is an authentic duty stamp. You don't need ultraviolet light. For most newspaper stall operators, they have to identify real banknotes. Therefore, they have the ultraviolet light with them. So for duty stamp, if the newspaper stalls have ultraviolet light, you may ask the stall operators to put the duty stamp under ultraviolet light to tell whether it is fake. So we're talking about physical anti-forgery features. There are also going to be metal threads on this duty stamp. So again, you can tell by naked eye whether the duty stamp is fake. As for the question about QR code, I'll ask Dr. Lam to respond. Dr. Lam, we drew reference from Australia as well as other countries when coming up with the specifications. Currently, cigarettes sold on the market, the health warnings or the track and trace identifiers are included in our specifications. As for the track and trace identifiers that the member mentioned, it is a requirement from the EU. In Hong Kong, we don't have the same requirement. In future, we will follow the existing specifications for the identifier. Apart from the identifier, we have what we called a mark showing the place of origin of the smoking products. The tobacco traders can include English words or numbers or other symbols for them to track the place of origin of the smoking products. These are printed on the existing smoking products sold on the market now. Reverend Peter Kuhn, Chairman, I don't think we object to tobacco control. Apart from using, for example, plain packaging requirements as well as duty stamps to control the use of tobacco, I'm thinking if we can adopt other means. One difficulty for us to distinguish cheap whites from duty-paid cigarettes is that we are allowing people to bring in 19 duty-free cigarettes to Hong Kong. Well, would you consider doing away with this requirement? That is, anyone who brings duty-free cigarettes have to declare that to the CNED, and you have to put a label on that. Anyone who is carrying a duty-free cigarette without label would be unlawful. That way, it can save you a lot of time and effort. Otherwise, people may end up getting illicit cigarettes. So I want to know if we can go one step further in terms of our tobacco control effort. The only loophole we see is that we are allowing people to bring in at most 19 duty-free cigarettes to Hong Kong. If you ask the CNED to put a label on these duty-free cigarettes, then problems will not arise. Otherwise, people might be able to put the 19 sticks of cigarettes they bring into Hong Kong in packaging. Secretary, as we consider these tobacco control measures, we have to take into consideration the effectiveness. We have to strike a balance because we have to consider whether it would cause an impact on inbound travelers. In relation to the policy of allowing people to bring in 19 duty-free cigarettes, we will look into this. This is because it would affect inbound travelers. We're just talking about a small number of duty-free cigarettes that can be brought to Hong Kong. Next, Ms. Rebecca Chen. Thank you, Chairman. Any policies that can lower the smoking rate and prevent young people from trying to smoke, I support them. I have the following questions. With the plain packaging requirement, you are going to impose requirements on, for example, the color as well as the coat of the packaging. This is quite strict. Would you learn from other places? For example, in the past, it takes time for people to replicate the color or the brand names. How can you ensure that you can step up the anti-forgery features of the packaging? Also, I am concerned about the cost effectiveness of the plain packaging requirement.
Well, you have used Australia as an example. Well, back in 2012, when they implemented the plain packaging requirement, and of course the smoking rate amongst those 14 or above, well, at the time it's about 16%, so it's about double that. It's about double the number of Hong Kong's young smokers, and then well, by 27, and then it's about 4.42 amongst those aged between 15 and 17, and then in Hong Kong for those between 12 and 18 years old, the smoking rate is only 1.1%, and if you take the entire population as an example, then it's as low as 0.5%. So Australia has adopted this plain packaging approach, and they have managed to lower the smoking rate. But then in Hong Kong, we have other initiatives in place to lower the smoking rate given the situation. The plain packaging proposal this time, how many more people do we have to send out to do the inspection? And what about the costs of enforcement and so on? So what do you expect to achieve after the introduction of this new measure? We have heard that Australia has been highly successful, but then they haven't even started to ban e-cigarettes, and therefore, as a result, they have managed to significantly lower the smoking rate. We would be able to achieve the same result, and then after the introduction of this plain packaging, many more things will have to do in order to boost the smoking cessation amongst young people. So while we introduce this new measure, we should also use incentives to attract them to cease smoking. So we should adopt both the carrot and stick approach. So what about the carrot instead of only the stick? So what do you propose to do to encourage youngsters to cease smoking? Well, the reason why we have introduced this duty stamp system, that's the best proof as to whether or not these are duty paid cigarettes or white or cheap whites. Chairman, I'm asking about the counterfeit cigarettes. So you talk about the duty stamps, you use different colors and different brands and so on, but then if all the packages look the same, with the same colors and same sizes and so on, well, for counterfeit cigarettes, they would not be able to get the duty stamps. So C&E department will be clamping down on such illicit cigarettes. I can ask the Assistant Commissioner to explain a bit further, but then I think Ms. Chen, your question is about counterfeit cigarettes, and then they can have the stickers attached, and then they can falsify as duty-paid cigarettes. Well, the C&E department is responsible for tackling the issue of counterfeit cigarettes, but then the ratio of such cigarettes is not that high, because just imagine if they are illicit cigarettes, they'll be sold at some $20 to $40 a pack. But then if they were to counterfeit the cigarettes, and if they were to sell that at the same price, then I think the incentive is not that high, because for cheap whites that they can sell it at a very low price. But then if they had to counterfeit, and then if they had to sell it at the same price, then that would be rather difficult, because that would not be very viable. And then, as our duty is to combat such cigarettes, if there are indeed counterfeit cigarettes entering Hong Kong, then we will try our best to deal with them. And then for the watermarks and also the stickers, they would show whether or not the package of cigarettes has paid its duty. So that's what we are going to do by way of inspection and spot checks. So we will check if a package of cigarettes has complied fully with the requirements, for example, whether or not it's suspicious and so on. Well, when we go to the warehouse to check the inventory, we will pay special attention to that. Thank you. Concerning the smoking cessation service, well, these two initiatives do not mean that we rely solely on them to control smoking. As I said at the beginning, we have adopted a multi-pronged approach to lower the harm done by smoking. So we have resorted to legislation, publicity, and education, and so on. So we will do everything we will do everything simultaneously to achieve the objective. We will not only be relying on these two initiatives. Well, taking Australia as an example to show the effectiveness of such measures, I'll defer to Dr. Lam to answer. Well, in other jurisdictions, the reason why we have specifically referred to Australia, because they have done that for the longest period of time, and they've also conducted a large number of studies to show the effectiveness and so on. As to whether or not Hong Kong will achieve the same target as that in Australia, we simply do not have the figures. But then, as the Secretary just said, well, the entire smoking control policy is that we are going to adopt a multi-pronged approach, and individual measures, when they add up, they will have a compounding effect. And therefore, at this stage, we do not have any concrete figures to estimate as to the effectiveness or to what extent will we be able to lower the smoking rate. But then, looking at overseas experience, with this measure, we will lower the usage rate, and then we would also be lower the first-time smoking of youngsters. And then even for smokers, they would also pay more attention to the health warnings on the packets. Well, for the plain packaging requirement, the cost is to be shouldered by the manufacturers, because every time when there is a change, they will have to change the packaging at their own cost. So as far as we are concerned, conducting patrols and inspections would not cost us anything more than what we used to do. So I'll defer to the Deputy Secretary to elaborate. Yes, I thank the Honourable Member for her concern about young people smoking. Well, there was a study targeting 12 to 17-year-olds. So after the plain packaging has been in place for a year, there was a study on this, and indeed, in terms of the number of youngsters understanding the harm of smoking, there has been an increase, and also with regard to the dependency rate on particular brands of cigarettes, there was also a significant drop. It was positive. And therefore, it shows that it helps to lower the smoking rate amongst the youngsters, and also whether or not they can have different things, for example, pictorial descriptions and so on. Well, without those, that can also help reduce the number of youngsters having contact or using cigarette products. Hong Kam Yin, well, you have introduced this plain packaging in order to lower the attractiveness of smoking, and that also goes to reduce the number of young smokers. You have also cited the figures in Australia and France to prove that. But then, do you have any consideration as to whether or not that would mean that more people will be resorting to cheap whites? And also, the current figures would be about lowering the smoking rate. Well, do those figures include the number of people smoking illicit cigarettes and also cheap whites? And also in the community, when I was a district councillor, I worked on many occasions with the C&E department to go into the community to publicize on how the authorities are combating on illicit cigarettes. I've also appealed to the public that they should cease smoking, and young people should also refrain from smoking. They should understand that from the publicity campaigns, and there are also posters and flyers telling them the harm of smoking. But then what about the C&E department's figures on combating illicit cigarettes? In the community, we receive a lot of messages about young people making use of their summer holidays, and then they would try to make quick money by selling or distributing illicit cigarettes. I'm very worried about that, because on the one hand, I support the government's initiative to combat illicit cigarettes, and yet on the other, I have also seen figures that there are actually an increasing number of people resorting to illicit cigarettes. I don't know whether or not it's true, but then in terms of publicity, well, they are actually reaching out to private buildings or even public housing estates. So in a community, we will have to step up publicity in order to clamp down on that. But then apparently the result is very limited. So can the administration tell us how you plan to combat such illicit cigarettes in the future? Thank you, Chairman. We have been very concerned about this. And therefore, in the 10 initiatives that we proposed with regard to the duty stamps system, we hope to introduce that as a matter of priority. Well, for the duty stamp system, we believe that that will be more effective in combating cheap whites, so that whether it's the law enforcement agents or the retailers and also the consumers, they will be able to tell immediately whether or not these cigarettes have paid the duties. And then on law enforcement, I'll defer to Mr. Kong, our Undersecretary, to explain. Yes, thank you. Well, on the study on the smoking rate is done very scientifically. The C&S department help us to do that. Well, in terms of the smoking rate, actually the questions put to the respondents were very simple: whether or not they are over 15 and whether or not they do have this habit of smoking every day. So we would not be asking whether or not you're smoking illicit cigarettes or duty-paid cigarettes or not. So that's the same as what we did in the past when we conducted similar surveys. Well, from 2023 to the recent years, the fact that there has been a drop in the number of smokers, I think is a precise and accurate finding. What about C&E answering the question on combating illicit cigarettes? Yes, Mr. Hong, as you said, the C&E department has been working closely with different organizations to publicize on illicit cigarettes and so on. We've been working closely with district councillors, the pub and bar sector, and also the housing department and so on. In different districts, we have also been mounting publicity campaigns on that. We have also stepped up education on youngsters. We have visited schools and youth organizations to organize talks to publicize on the anti-illicit cigarettes campaign. We have also reminded youngsters not to take part in illicit cigarette-related activities. And then in terms of figures, in 2025, we arrested a total of 470 youngsters below 21. And then compared to 2024, it was up by some 45%. But then for those who engage in such activities in the city, only 9 were involved. When compared to 2024, it dropped by about 50%. So it shows that for youngsters, taking part in illicit cigarette sales activities is not as serious as what one might have imagined. We do not see a growing trend of youngsters getting involved. But then, of course, we will continue to step up publicity to ensure that young people will no longer be taking part in such activities to sell or distribute illicit cigarettes. Finally, Christine Fong. Thank you, Chairman, and thank you, Bureau Director and the Bureau and Department. Well, in fact, we had a tobacco manufacturer who passed away recently. He also publicized and did a video clip to call upon the public not to smoke. I think the Smoking and Health Committee in the second quarter of 2027 would also be simultaneously implementing the plain packaging and also the duty stamp system. I think it's a bit too late. I hope that it can be expedited. So have you done any evaluation? That is it possible to expedite the date of commencement? Can that be done earlier? So for the law enforcement agents who have to adapt to the new system, in particular the CNE staff, I agree with Mr. Hong from Kwun Tong, because in Sai Kung and Chang Kwan O, we also have illicit cigarettes that are being sold or touted in public housing estates, and even universities have young people smoking in front of the entrance of the universities. And therefore, education and publicity is very important. So can the CNE department step up publicity and have more staff doing the authentication of the duty stamp, and also can you do more education and so on?
Secretary. We aim at implementing the duty stamp system as well as the plain packaging requirement in December 2027. And we have balanced a number of factors by coming up with this date, because we took into consideration the time needed for tobacco traders to prepare the packaging as well as the duty stamp. We hope that this can be done in practice. There were people spreading rumors saying that there won't be any more cigarettes sold in Hong Kong. Well, I think at the end of the day, we have to rely on the CNED to take law enforcement action. I'll defer to the CNED to elaborate. CNED, on the manpower to combat illicit cigarettes, of course, we have dedicated teams that combat illicit cigarettes at the control points. We also have officers intercepting those who carry illicit cigarettes. It's hard to therefore quantify the number of officers we have dedicated to this. We have about 50 officers responsible for combating illicit cigarettes. Where necessary, we would redeploy manpower flexibly. Just now, Ms. Fong asked whether we would step up publicity. Of course, we will strengthen publicity as well as education. We will, on various fronts, launch our publicity as well as education campaigns. We won't just focus on combating illicit cigarettes. Any follow-up questions, Ms. Fong? All right, thank you. We're wrapping up this item. Members, do we agree to this legislative proposal? Okay, most members support this proposal. Last agenda item, any other business? There being no further business, meeting adjourned. Thank you.
前邊。